Hello, I'm Robert, fact checker and science blogger, and this is about things that most people don't know about 10 ways to protect yourself and your loved ones against COVID and how we can all help stop our outbreaks by following the WHO recommendations. And I'm just sharing the good information as the WHO recommend. Please sure to check any YouTube blogger's advice against reliable sources, unless of course it's like of the WHO themselves or Dr. Fauci. And then if you are also, it's very good to share the good information with other people, and in the same way make sure that they know how to get the good advice and where the good advice is. So first, most people don't know to isolate from their own household, and you can still protect your loved ones if you develop symptoms of COVID. And so this is just to maybe jog your memories about this Li Ting, an emergency room nurse who looked after his wife at home in Wuhan. And back then we understood how serious it was. But now, and even now, a health worker wouldn't dream of going to a COVID-19 ward without protecting themselves from getting COVID. Yet so many people at home are looking after a COVID case in their own house with no protection. You should protect yourself. You should take the same care as a health worker and as he did. The disease hasn't changed. You should designate the least vulnerable household member to look after the COVID case. And you should follow the WHO advice. And the disease spreads in rare super spreader events, even in households. And most people, like 71%, don't pass it on to anyone. It's really quite remarkable, this virus. And so you most likely, and only 8% are responsible for 60% of the transmission. And so you most likely, if you've got the symptoms, isolate straight away before you get the test results. If it's suspected COVID, immediately isolate, and you can help prevent the future super spreader event that might be about to happen in your own household. And in that way, protect the rest of your household. So many people don't know that. And then I'm astonished, many people don't know the emergency symptoms either. And they try to home treat lack of oxygen. You should never home treat lack of oxygen. You should get an oximeter and put it on your finger or whatever. As soon as the oxygen levels go down, ring up emergency. Like Trump when he was whisked off to a hospital. Or any of the symptoms of lack of oxygen. It's usually 4 to 10 days after you develop symptoms, so you've got time to order an oximeter and for it to arrive before you've got a risk of this happening, if you catch it early. And this is especially things like if you are walking, like say you go upstairs and you get breathless, and you wouldn't normally get breathless with that level of exertion, just walking about or even in bed. It's different from a panic attack. If you're panicking, and if you're used to panic attacks, you will know how this feels, and it's usually over within about 20 minutes or so, and it's not the same as a panic attack. And so a quick response will save lives. So most people do survive being breathless at home with COVID, but the home remedies you do to ease the breathlessness does absolutely nothing to deal with the problem of lack of oxygen. And many have died trying, and all those lives could have been saved. Then this is just a small thing about soap. Then many people will say, what shall I do? I've run out of the alcohol hand rub. Somehow the message seems to have got over that the way to protect yourself is to use alcohol hand rub. It's actually soap is much better. Alcohol hand rub does work. It's fine if you're out and about and you haven't got soap. But if you've got soap, and a little drop of soap, this particular virus is not true for all viruses. It's covered in lipids, and just one molecule of soap will break it apart. It just basically explodes. And get into the habit of washing. Basically what you've got to do is you've got to get the soap to every part of your hand. And if you do that, then the virus is gone, including between the fingers, and follow around the thumbs and so on. Follow Dr. Tedros' advice. Follow his video, do it several times, run it through, copy what he does, and it'll become second nature. Then most people don't know that you should quarantine away from your household right away, again without hesitating, as soon as you know you are contact. And the thing is, they don't understand quite how it works. So if you are a contact, then, and you've got no symptoms, you might think, well, oh, I didn't get it. You might even get tested and test negative and think, oh, I've tested negative, so I haven't got it. That is not how it works. If you are a contact, and if you did get it, the virus will be in you undetectable, even to the tests. Even if you get tested every day, then you still can have it. And many people, most people, it's several days, it's half of them don't get symptoms for 5 days, and many don't get it until the second week. So as soon as you discover you're a contact, it doesn't mean that you're safe if you haven't got symptoms. Immediately isolate away from the rest of your household, and the aim is to stop it in the pre-symptomatic stage before you know you've got COVID-19, when you're also very infectious at that point. And this is my client's golden wish, and I will just play my client's golden wish now. Let's maximize it.
You know, let's be plain and honest here. If you are a case or you're someone who's positive, you should be at home in full isolation or in a clinical care facility. If you are a contact of a case, if you know yourself to be having been in contact with the case, you should be in full quarantine at home without contact with other people, or in a third facility and without contact with other people. And that is not so as to imprison people, that is so as to break chains of transmission. If we're seeing transmission now at community level, and then we do big major lockdowns and we push that transmission back into the household, and what we're seeing in many European countries and North America is that a good deal of transmission is occurring at the household level. So it's gatherings at home that are doing a good deal of the transmission. So even if you end up with a societal level lockdown and people continue to gather in those environments, we're still going to promote and continue transmission. So countries are facing many dilemmas right now. But for me, if I get a chance or a golden wish to improve one thing that we could really improve and change the game here, apart from all of the other advice about using masks and physical distance and asking that people can stay the course, and it's tough, but if I was being asked, as a public health physician, if I was asked for one thing that could improve, that might change the game here, that is making sure that each and every contact of a confirmed case is in quarantine for the appropriate period of time, so as to break chains of transmission. And I do not believe that has occurred systematically anywhere, and particularly in countries that are experiencing large increases now. That has been very hard to sustain over the summer, and I think a good part of the reason why we're seeing such high numbers at the moment.
And so much of this, many of the points here are ones that he made in that short speech. And as we are in lockdown in the UK at the moment, and at this time it is especially, depending which tier you're in, as he just said just then, this is a time when we've pushed the bit back into households. And you need special care. If you've got people gathering in households, then that can be when it spreads. It's actually, all the way through, lockdown or not, 80% of the transmission is in households. And if you can stop that, if you can do the quarantine properly, if you can do the isolation properly, then you can stop a significant fraction of 80% of all the transmission. If you do isolation properly and you do quarantine properly, we could bring the R0 way down if we did isolation and quarantine properly. So find out how to do the quarantine if you are a contact. And if you are a contact, you most likely don't have it, but you quarantine in case you do have it. You don't know if you have it until you develop symptoms, or you may even be asymptomatic, and so quarantine all the way through. And don't break the quarantine. Get someone else to get your food for you and so on. Phone your shop or whatever. then most people don't know that you can do your own contact tracing. Don't wait for the contact tracers. If you have COVID-19, ring up or text or email anyone you are in contact with. So you isolate as soon as you suspect COVID-19. Once you get the test result back and says you have it, then immediately tell everyone. And these are the people who you were in contact with for 15 minutes or more. It's not someone you're sitting next to on a park bench. It was someone you're talking up close up. You weren't doing the physical distancing properly. You were too close to them, and you talked to them for 15 minutes or more. People like that. And in the 2 days before you develop these symptoms, then ring them all up. The ones with very close contact are the top priority. So if you are contagious with symptoms, you see, if you self-isolate, then you will stop some of the people that you pass it on to, but not all of them. If you do the quarantine, then you will stop just about all of them. If you can manage to quarantine 2 days before you develop symptoms, you will not infect anyone. And so the quicker you quarantine, the better. Even though you feel absolutely well, you haven't had any symptoms, still quarantine. And if you do that quickly, and unlike flu, first of all, flu spreads too fast to quarantine like this, for quarantine to work. And most of the contacts with COVID, unlike flu, will be people you have the phone numbers already, or you know how to get them to a boss or event organizer, etc. You don't need an app. That's just to jog memories. Then number 6, most people don't know how effective the good habits are, such as physical distancing. I mean all of them, including mask wearing and everything, but most people particularly don't know about physical distancing. They know you're supposed to do it, they don't know how important it is. It's like looking both ways when you cross a road. Your risk of a traffic accident is nearly zero, but if you are in a city and you keep crossing roads without looking, then eventually you're likely to get a car accident. And it's the same with COVID. If you physically distance, then you're very safe. If you don't physically distance, then you're in your place where there's high levels of community spread, then eventually you're likely to get it. It may take weeks or months, but eventually you'll probably get it. And the virus mostly spreads through large droplets. And the ventilation, it helps if you're indoors, but it doesn't protect you if you talk face to face within 1 meter of someone, indoors or out. And you don't need a mask actually if you're more than 1 meter apart in a good, well-ventilated place. Unless, of course, your boss requires it or the government requires it. But this is the World Health Organization. You can see that this shows the droplets. They're too small to see, but they're big enough to just fly like a ball under gravity, like that, from one to the other. Mike Ryan and Maria van Kerkhove, they're far enough apart so the droplets, when Mike Ryan is speaking, can't go to her. They're also facing in different directions. So it's mainly when you're facing towards someone that you have the highest risk than if you're facing in a different direction from them. And then the next one, most people don't know that you need a lot of virus to get infected. So if you look at this varies very much depending on the virus. So adenovirus and H2N2 flu, then for those, one virus of this with near certainty and you've got it. And this 1 to 3 viruses, a bit over 1 to 6 viruses, but this is how you interpret that. You double those numbers, it's pretty much certain. Well, it's not. The 0.6 to 3 is half, means half of people get it. It's not really strictly true that you can double it, but it gives you a rough idea. And so for COVID, several hundred viruses are needed for a reasonable chance of success. And that is why close contacts matter so much, because a few viruses on packaging would not affect you. And so many of the people who contact us are very anxious about packages they get through the post. They aren't aware that the WHO have said very clearly that there's no evidence that you can get it from food or food packaging. It's mainly through person-to-person contact and direct contact with respiratory droplets. And it's not even certain that you get it from surfaces, although the problem there is that usually the surfaces and the droplet transmission happen at the same time, so it's difficult to disentangle so it's hard to know about that too. But it's okay to do it for peace of mind. I actually do that myself for peace of mind. When I come back from the shops, on the first day, certainly not after that, then I do wash the outside of the packages, and just in case someone spattered it or something, it's not very likely. And anyway, but that's not where your focus should be. Your focus should be on the distancing, and the mask wearing helps if you can't do the distancing. And most people don't know that you can avoid COVID fatigue, and this is something that for some reason not even the experts on TV have been saying. I don't know why, because a psychologist friend put me onto this. But what you need to do is to make it all automatic. It's like learning to ride a bicycle like a musical instrument. So for instance, the instructions on how to wear and use a mask are rather complex. But we are very good at learning such things. So learn how to put on a mask, learn how to take it off, learn that you need to have a bag or an envelope to put it in, that you don't touch the front of the mask, and go through just one day of doing that. And just reminding yourself your instructions is then automatic, and then you will never do it. And you'll just do it all properly. Luckily, the masks seem to work, even with people being very sloppy and touching the front and doing all sorts of, and wearing on their chin, all sorts of things they shouldn't do. But do it properly, and you've got the best chance of protecting yourself with the mask. Always step back. So make it so that you are the stepping back person when you socially interact. That is easier for you and easier for everyone else. Hopefully you influence them to do the same, whether or not. They will get used to you as the person who always steps back when you socially interact. And then it's much easier. And just say, I want to physically distance, they will understand nowadays. And then just step back. Everyone then in that situation will understand and will step back and will understand, even if they don't do it themselves. And that way it becomes automatic. You don't get fatigue. What makes it fatiguing is when you're constantly preoccupied. Should I or shouldn't I? Should I do it in this situation? Should I do it in that one? Just get very clear. With my bubble, it's okay. I don't need to physically distance unless I'm isolating or quarantine. With everyone else, I do. I automatically step back unless I'm forced to in some situation, like my work or something. I have to be close to people for some important reason. And that way, you can keep this up until it's all over, and then you can all celebrate. And so this is just this thing that if you would not, if you're in a city, you will always look both ways when you cross the road, and it just becomes automatic. It's not that you don't get road crossing fatigue. People who've lived in cities all their life still don't get fatigue about looking both ways when you cross the road. In the same way, there's no reason at all to have any fatigue about stepping back, so long as you make it automatic and not something you're constantly thinking about. Then this is the next one. Most people don't understand how random COVID-19 is. They don't understand the factors that lead to some apparently identical people having it or not. So you get people who say, well, I've got several friends and none of them had anything happen to them. Nowadays, quite a few people have friends who have had COVID-19. If one of them died or one of them got long COVID, then they will take it seriously. But if they just so happen to have had friends who were not badly affected, then they will think, oh, I don't need to do anything. That is the wrong message to get. Because if you're over 90, then most people will survive, but 1 in 6 or something like that will die, and it's just random. They don't know the reason. There's some excess risk if you've got underlying vulnerabilities, but even if you're healthy, 90-plus-year-old, there's a 1 in chance of dying, 1 in 6 chance of dying. They don't know why, and they don't know what causes that. So it's like playing Russian roulette with your life. If you are a young person, it's the same with long COVID. They don't know the factors that lead to long COVID. There's a perhaps 1 in 10 chance. It could be more, it could be less. It's hard to know. It's very similar to Russian roulette. Most people survive Russian roulette. Do you want to play this game with your life and health, or wear a mask and physically distance? And with a young person, you could be sick, and this is really sick, like flu. You're really tired. It's hard to get the energy. Just go down to the shop 200 meters away, and before you got COVID, you were someone running up mountains, and they don't know how long it lasts. Some people have had it for the entire duration of the pandemic. You do get over it gradually, but some people have it for a very, very long time. They don't know. It's not impossible that for some people it becomes a lifelong issue. And so don't play Russian roulette with your life and health. And so instead of all that, become a superhero in your community. So this is a summary of the do-it-all. You can the face coverings, the contact tracing, you know your contacts. Physical distancing, automatically step back. Vaccination and mass testing, that's for the government. But when you get the vaccination, it will reduce your risk. But doing these other things is actually better than vaccination. The hand hygiene, that you need to do everything, do it as well. But this is actually more effective than vaccination if you do it properly. Because it's 1 in 20 chance of infection with vaccination if you don't do the other things and you do very risky behaviour. And then the quarantine, and then stay informed and also inform others. And so that's me nearly finished. I just want to talk briefly about so few governments are following the World Health Organization recommendations. And so if you have any influence with your government, then then do try and get attention to them. I have tried writing them, it's very difficult to get through because there are so many people talking to them. I've never had any replies. But apart from basic acknowledgement. But if you are able to do that, then do it. Try the best you can. Get some attention to this. The WHO advised that they should offer quarantine in separate hotels. That's what they should be doing. You then have zero risk of passing it on to your household after quarantine starts, with trained staff or community centres. And they should be supporting it. They should be very supportive. They should be giving you food in your hotel for free, so that people have a strong incentive to leave home and go and spend time in the hotel being quarantined. And especially people from deprived areas where it's very difficult to quarantine. And they should isolate all confirmed cases in separate wards if they can. Now there's obviously not enough ward space, so then hotels or community centres converted into wards. And that's the big stadiums in China were like that. If that's not possible, a health worker should definitely look over your household and advise you how to home isolate. You shouldn't have to rely on a YouTube blogger like me or having to find out for yourself on the World Health Organization website. Someone should have come round and told you all this. And a health worker should phone you up every day while you're isolating for COVID. And very few countries are doing these things. But if you are COVID aware, you can do much of this yourself. And you can do your part to help stop the spread, at least in your own community. And then if every community does that, then that becomes a very large thing. And you can go viral and share things, share the good advice with other people. And then if they then share with other people, and in this way, by sharing the advice from the World Health Organization, if you're a blogger, do what I'm doing, and tell your followers and your fans what to do. And let's get everyone learning this. We can do a lot via social media. That's something we've discovered since the coming of social media, that even if the governments aren't doing much, then you can do a huge amount via social media. I'm actually very hopeful with Biden in the United States, because he at least is going to be communicating like Jacinda Ardern to the general public in a very clear, direct way, and that makes a huge difference. And communicating the science and just the science. And so the future looks good. We will be over this to the most part in 2021. The world actually has a capacity for vaccine doses for 10 billion people if they really step up. And we have already pre-ordered vaccine doses for getting on for 3 billion people, 2.5 to 3 billion people. And the World Health Organization has pre-ordered enough for 1 billion people. That's assuming most of the vaccines work. We've only got the Pfizer and the Moderna, but AstraZeneca almost certainly, the Russian Gamma Layer 1, there are several others, all in phase 3. It's likely indeed that all of them pass, or most of them pass. And then we'll be awash with vaccines next year, so long as we continue to step up, make sure everyone gets them. And so, but we don't need a vaccine. Actually, this physical distancing is better than a vaccine. It's more effective. And 20% of the world population is like this already without a vaccine. And we should be learning from them. I was very glad to hear that Biden and Jacinda Ardern have been talking to each other and learning how New Zealand stopped their outbreak. And we should be learning from Taiwan and China and everyone who has stopped it. And Laos and Vietnam and all the countries that have actually stopped it, either without a lockdown or with a very short lockdown. And so we can do this without a vaccine. Then if you're doing your bit, you're helping to reduce the cases per day. If we keep reducing the cases per day effectively, then we can get back to 1 in a million like they were in the UK in the summer. In Scotland, they were down to a few per million in the summer. But sadly, we didn't push it all the way down. And it's absolutely vital. The World Health Organization gave this advice, which the New Zealand is following, and that is that once you got down, so New Zealand reduced it tenfold in 25 days. This is what we can do if we do all the things I said here. If we do that ourselves, we don't even need the government to do it. If we all did these things, it would go down like that. Because remember, you can do your own contact tracing. We do need the government for the testing, but luckily most governments now have enough testing. You can bring it right down like that. Now, the important thing once you're right down there is you've got to keep on going down. And so many people go down to about there and then they start going up again. You just ease up everything. You've got to keep on really hard, really tough. That's why Australia has gone really hard in the last few cases. We've got to do that. So that's really important. And then if we do that, we could stop it long before we are vaccinating everyone. And if we do this but not very adequately, we can bring it down to a few per million. Then if it's super spreading in some particular city or village or some particular community, then the vaccine, going hard with the vaccine as well going hard with everything else. And we can stop it much faster. We could stop it much faster even than New Zealand did if we use the vaccine along with everything else. But meanwhile, the vaccine will reduce the people. They're vaccinating the most vulnerable right now. Stopping it depends on the vaccine stopping transmission. It seems quite likely from Moderna evidence that it will, and from other indirect evidence. But right now they're vaccinating. Things are looking really good for the future. Right now they are vaccinating the people who are most vulnerable, the elderly, and the frontline health workers and some other categories that are most vulnerable of getting it because of their job or because they're elderly. Then this will have an effect, but not straight away. It takes, you do get some effect right away with the first dose of the Pfizer and Moderna vaccine, so that is good news. So they will have some reduction in risk right away. The best reduction is a month from now, and we're talking about end of February, March, before you get a real hit on people being vaccinated now. But you will get a hit earlier on because of the first dose giving some protection. That will give some protection towards the end of January. The deaths will be going down. But we can stop the infection right away if we do these things. You don't need to wait. And most of us won't get a vaccine until late. I probably won't get a vaccine until late spring. I will be jumping at it when I do get a chance for a vaccine. But my risk is zero really, because I do everything else. I do all the physical distancing. I do everything right. So you can have an effectively zero risk by just doing all these things effectively. And if your entire household is also doing these things, if you are in a household and they don't have a job that puts them at risk, then you can basically get your risk down to essentially zero, even if you're in the United Kingdom or the United States. And don't worry about this new variant. I've got a separate video about that. It's the same method of protection works with that as with all the strains of COVID-19, and they don't even know that it's more infectious. But that's for my other video. So I'll stop this now and I'll upload it. I hope this is helpful. Do please check the reliable information. My link to the blog post is in the video description. Don't just accept this because I said it or because some other random YouTuber blogger said it. Check up what I said against the reliable sources and encourage other people you know to check up with reliable sources the information that they receive, whether on YouTube or over the internet in any way, or on social media. There's so much infodemic being spread, so much false news. Check up with reliable sources and don't rely just on some YouTube blogger, especially someone you don't know, and you don't know if they're reliable and if they check their sources. And be sure to check the sources. And I will now upload this.